Last week we learned the causes of lateral thigh pain. We reviewed the muscles. Sharon taught us how to evaluate the function of each one of these muscles in pain key number 21. And the causes of lateral thigh pain, the most common cause was a muscle called the gluteus minimus, then vastus lateralis. And all of you have this chart right here. We went through each of these muscles. We learned how to treat it, learned how to do self-care so your patients can treat it themselves, and we learned how to we started to learn how to evaluate muscle testing. We evaluated range of motion, and we started to learn muscle testing. Now, we did go through that kind of fast, so I wanted to give you a better understanding of kinesiology. I was involved in a study at Vanderbilt University that proved that there is a distinct difference between conscious control of muscle activity and unconscious or subconscious control of muscle activity. What that means is that there's a little nerve at the dorsal root of your spinal column. This is your spinal column cross section. There's a little nerve that comes out the back here and it goes down to your muscle, and that nerve receives input from all higher nervous centers, all lower nervous centers, and all sorts of peripheral nerves telling it whether it should fire or not. So the muscle takes orders from your nervous system on whether it should fire or not. We talked about a unique injury called a hip compaction, where little Golgi tendon organs that sit in the ends of your muscles and detect whether there's been injury will act as light switches that turn off the muscle. And we talked about how working with your manual therapy, working on the origins and insertions of the muscle can cause those Golgi tendon organs to switch back on and cause that muscle to immediately regain its strength. Now, what strength are we talking about? We're talking about the unconscious portion of strength. Let's say you've ever been really depressed or tired or had the flu. You probably noticed that when you're getting out of bed, you felt tired and sluggish and weak. Was that because your muscles got any weaker while you were sleeping? No, of course not. The muscles aren't weaker when you have the flu. They aren't weaker when you're depressed. They aren't weaker when you've had an injury. They aren't weaker. It's just that they aren't firing. They aren't working. Now, like a dimmer switch, only some portion of the muscle is actively working and the other portion is not. So we proved in this study that there is a certain portion of muscle activity that is consciously controlled. You say, I want to lift my arm. And there's another portion that is unconsciously controlled that says, yes, but I'm only going to let you move it this far, or I'm only going to let you lift this amount of weight. And those unconscious portions of muscle control are not affected by your will. They're affected by unconscious processes in your nervous system that involve your mind, your emotions, that involve different input from peripheral nerves like Golgi tendon organs like we talked about, and a whole other host of factors. So when you get into muscle testing, the thing that happens is you are opening your mind to a whole bunch of information going into the simple fact of whether a muscle will fire or not. It can lead you down a path of psychology that's deeper than anything you could learn in school. It can lead you down a path of metaphysical awakening. It can lead you down a path of incredible neurology, make you one of the top applied neurologists in the world, able to test and detect neurological problems. It can help you detect whether the body's reacting to a stimuli like a food or an idea or a thought or a physical stimulus. You can use muscle testing to identify and evaluate a whole host of different stimulus inputs into the body and the body's response to that. Does the body immediately withdraw from that stimulus, like the idea of love or romance? Does it immediately withdraw from that? Then there's an indication that your mind is probably has some fear surrounding romance or love or something like that. Is there a particular food that if you taste or a smell that you smell, does the body withdraw to that? Then there's an idea that your body may have a sensitivity or a negative reaction to those kinds of things. And in this way, it seems like the body does talk. And it really does. The nervous system is integrating all the inputs, all of your senses, your sight, what you see, what you hear, what you taste, what you touch, what you smell, what you think, and what you feel emotionally all at once. And it's integrating all those, and the output of that integration can be detected in a simple muscle test. I'm not going to go into the depths of all those different fields, but I am going to tell you how to do a muscle test properly. Okay? The first thing you need to understand is that you have to be able to feel, and this will be an awakening process within you, the difference between a conscious muscle contraction and an unconscious. In the beginning, I'm going to show you how to do it so that you don't have to think so much and your feeling doesn't have to be so proficient. I'm just going to show you how to engage the full conscious portion of muscle contraction and then test additional amounts of unconscious control. And that's just going to work like this. So imagine that I am pushing out into my hand. This would be the patient, and this would be the practitioner. I'm pushing out into my hand, and I'm going to push as hard as I can consciously. This hand, you as the tester, are not pushing back. All you're doing is receiving the amount that I'm able to push and meeting it. So they push, you receive, and then you meet what they're giving you. That is the conscious control of muscle, conscious portion of muscle contraction. And that can be anywhere between 25% of full muscle strength to 50 to sometimes very little. Some people are very sensitive and only about 10 or 20% of muscle strength is consciously controlled. It depends on the person and on several factors which I'm not going to explain right now. But it is true in every case that an individual has a certain control over muscle contraction that's conscious, and the rest is controlled unconsciously. Now, you may find some difficulties with people who are in stressful situations. They're in a fight or flight mode, and they aren't relaxed enough to do these kinds of tests. And at some point, maybe I'll show you a simple relaxation exercise. You can just find this acupuncture point right under the clavicle, and you can close your eyes and breathe in and out into your nose and out through your mouth about 6 times. It's just a relaxation exercise that helps people kind of focus on breathing and get out of their heads and get out of that stress. Sometimes they're jacked up on caffeine or other stimulants that will cause this testing to not work. So there are lots of variables, but nevertheless it's worth understanding at least the science and then what that means about your work as a body worker. Okay, so let's talk about it again. So this conscious portion of muscle contraction is felt by them pushing into your hand and you simply receiving and catching and meeting their amount of pressure. Then additional amounts of unconscious strength are added when you push a little more than they gave you back. Then they have to meet that, and you give a little more, and they have to meet that, and you give a little more, and they have to meet that. You can provide 3 to 5 additional increments of strength in a quick fashion so they don't get real tired, and ask them to meet your increasing amounts of pressure. So you start by this, you say, push as much as you can into my hand and hold that pressure. So keep pushing into my hand. So they push in your hand. Okay, now as I add pressure, I would like you to meet the resistance that I'm adding. Then you add more and they meet it, you add more and you meet it, you add more and they meet it. Okay? A neurologically facilitated muscle, one that can meet the additional amounts of pressure that you're providing, is considered to be on, firing, facilitated. Okay? If you experience something like this, push into my hand, and they push with their conscious effort, and you say, okay, I'm going to add, and they add, and then you add, and then it starts to give as you add more. That means that the unconscious control over that muscle is inhibited. Something in that dorsal root of the spinal column is interpreting all the input coming in and saying, no, we're not going to fire. Like if you had the flu, your nervous system, integrated with your immune system, has decided that you should not be up and moving around. So it's not helping you work your muscles. So when you get up out of bed, the same leg muscles that were strong 2 days ago are now really weak and tired. That's because the conscious portion of muscle control, which is dragging you around, is on. That's your willful ability to, it's your willful right to, fire those muscles, even though your nervous system is saying, hey, it's not not the wisest thing right now because you need rest. If you're depressed, you can drag yourself out of bed, but if your mental conclusions of your thoughts and feelings are such that it's not worth getting up and doing anything, then you won't get that help from your mind to do that. And likewise, if there's an injury in that muscle, an old injury, or we talked about the hip compaction, where the joint, either from dehydration or stepping off a curb or something, has gotten jammed in, one muscle, those Golgi tendon organs will start firing and be so tight that it shuts off all the other muscles in the entire hip joint. And that's called a hip compaction. We showed how just magically, if you work on the origin insertions of that one muscle that's really tight, all the other muscles turn back on, and that person feels like they got a new hip in just a few moments of therapy. Okay? So whether it's a physical stimulus or an emotional stimulus or something biochemical or your immune system, when you add, so they push, and then you add 1, 2, 3, and they can't meet additional increments of resistance, that means that that muscle is neurologically inhibited. We had a lot of fancy technology hooked up that was measuring the muscle response, and there were graphs printing out of what was going on. It's really neat to watch the difference, in strength of a fully facilitated muscle, and then an inhibited muscle cuts off like this. An inhibited one, strength curves look like this. A facilitated one looks like this. An inhibited one cuts across just like this. And we were able to prove that the muscle does indeed respond to stimuli in a reproducible way that will tell you whether that stimuli is good for you or not, according to your neurological conclusions. But in this case, what you're doing with your manual therapy is you're finding out if Golgi tendon organs are inhibiting a muscle from firing and causing you to have problems with a joint, because when all muscles aren't firing, then that joint is uneven and imbalanced, and it causes wear and tear and pain and all sorts of things. So with the muscle testing, we took each muscle individually and we lined it up so that the muscle fibers were exactly, if there was any twist in the muscle, we took the twist out and got the muscle fibers to be linear. Then we had them push in a perpendicular line to the fibers. So if this is the TFL, so let's see the tricep, right? If I was the tricep, so line up the tricep fibers, they line up just like this, all the fibers. So I'm going to push perpendicular to that line, see? Right? I had them push first, and then I added 1, 2, 3, 4, and they met all that. That was facilitated. Okay? But if I pushed, they push, and I add more, 1, 2, 3, and it weakened, that's 2 or 3, then I'd say that was inhibited. Okay? And we took that in the hip joint with the hip compaction. We know that one muscle is firing and it's overcontracted. Those Golgi tendon organs are really sending the wrong signals and causing that muscle to be extremely tight, and be very tender at the origins and insertions for that muscle usually. And all the other muscles will be inhibited. So we tested TFL, glute medius, glute maximus, hamstrings, rectus femoris, all these great adductors. We tested all these great hip muscles, and we found, sure enough, we had somebody who had a hip compaction, and all of the muscles were weak except for one, and it was the glute medius. And then we went to the origin insertion of the glute medius. That was the one muscle that tested super strong, where the rest of them tested weak. And we went and we pushed on the glute medius fibers at the origins and insertions. They were very tender. We worked at them, and it immediately reset the neurological circuit for that hip, and all the strength came back in all the other muscles. Okay? Now, a couple of neat things we did when those muscles were weak. We pulled on the hip to distract the joint, which gave more space in the joint for a second. And then we retested them. So we tested the TFL. It was really weak. And then we distracted the joint. And for a few seconds, it was strong again. So that was another way of demonstrating that the hip was compacted, was to distract the joint and see increased strength right away. And then we pushed the hip back in like you would when she takes her first step, of course. The body weight alone would push the joint back together, and then it weakened immediately. So that was a diagnosis, one way of demonstrating a hip compaction. But the real benefit of this, what I really wanted you guys to take away, was that your manual therapy, if you do it well, you're going to think about things like origins and insertions. You're going to think about things like neuromuscular junctions. So you're going to think about the muscle as not only just a piece of tissue, but as a neurologically active piece of tissue. And that there are all sorts of little nerves in that muscle and little nerve systems like Golgi tendon organs at the junction of the tendon and the muscle. Also little spindle cells in the belly of the muscle. And then neuromuscular junctions wherever the nerve, the alpha motor neuron, hits the muscle cells. That's another place. You want to be thinking about all those and make sure that your manual therapy is covering those things. And if you wanted to play around with the muscle testing, you can learn to get pretty good at it. No doubt you've been working with your hands, so your tactile intelligence is very high, and it's been growing every day that you work with your hands. The tactile intelligence grows, so you'll be very good at muscle testing as a body worker. You're probably one of the best inclined to be good at that, because you have been feeling tissue with your hands and learning and sensing and communicating unconsciously with the tissue as you're working on it in ways that you probably couldn't even describe in words. So that's what we wanted to do. Now this week I think we have an interesting case of a hip compaction where we worked on the hip compaction, but still two muscles were very weak at the end of it. We still had a weak glute max and a weak hamstring. And that is going to be most likely caused by the nerve roots. So another thing to learn, and the takeaway from hopefully this class this week will be that you should always treat the nerve roots, not just the muscles. So here you are, you're an amazing manual therapist. You are diagnosing the range of motion of a muscle and the pain pattern and palpation so that you can identify trigger points. And then you are also paying attention to the origin and insertions of the muscle and also the nerve root innervation of the muscle. And so this person, we found, and we'll demonstrate this week, that the L5 and S1 nerve roots were quite irritated, and that was inhibiting the glute max and the hamstrings. And even when we fixed the hip compaction, we still had those left over. So you guys are doing great work, and I wanted to show you this kinesiology to encourage you that your work has such powerful benefits, and to give you some explanations of why it works from a scientific perspective, and also to give you the opportunity to play around with some advanced techniques like kinesiology if you so desire. If you want to increase your tactile intelligence and expand your your intelligence and awareness and consciousness, that's a great way to do it. Be forewarned, when you get into muscle testing, it does open you up to the entire Pandora's box of things that could cause a nerve to turn off. There are mental, emotional reasons, biochemical reasons, physical reasons, immunological reasons. There are all sorts of reasons why, mechanoreceptor reasons. There are just so many that kinesiology, acupuncture reasons, that kinesiology is just extraordinarily rich field because it allows you to access all the information that goes into a simple muscle contraction. And it's pretty much your entire experience. All dimensions of your experience as a human being go into the contraction of a single muscle. So it is a field where you can easily get overwhelmed and lost. So I don't recommend necessarily diving headfirst into it. I think you should focus on your body work and keep serving your clients, because that's where within the scope of your practice you're still growing a lot in your intelligence, and you won't get overwhelmed, and you'll see great results. And I would use muscle testing to play around with, to increase my own awareness and consciousness, to prove the effectiveness of my work as a myofascial trigger point therapist, and just to have fun. And that's where I would leave it. So with kinesiology, I hope that last week I was able to show you the importance of not only treating the neuromuscular junctions where trigger points are found, the ones that cause referred pain patterns are found at the neuromuscular junctions, but also the origins and insertion points of the muscle, because that's so important to reset Golgi tendon organs, especially after an injury. And then also this week, I hope that we can show you through kinesiology and demonstrate the importance of treating the nerve root that feeds the muscles that are being affected. Okay? So when you do that, which is all included on this chart already, every single muscle, you see, you go to, we'll be looking at adductors this week. The adductor has a nerve root of L2 to L4. So those you would treat the multifidi, the rotatories, and all the little muscles that affect the position of that L2 through L4 vertebra, and thus affect the nerve root. And also you would, and then a range of motion test is right here. So all of these things are already here for you. So this time you'll remember not only to treat the adductor in the belly of the muscle and at the neuromuscular junctions, but also in the origin and insertion of that muscle. And also you'll treat the nerve root. And if that's what I can help you to prove the importance of with a little kinesiology, then I'll do that so you can realize just how important and effective your work is. Okay, everybody, we'll see you tomorrow night. Thanks for paying attention and for keeping on doing excellent service to your fellow human beings with this skill of yours that you're learning. Thank you. We love you. We'll see you very soon.